There's a radical new theory developing on the cause of multiple sclerosis. MS has long been considered an autoimmune disorder in which the body attacks itself. But new research points to a vascular problem. And early studies show it might be stopped or even reversed through surgery. It's generating excitement and words of caution from doctors who say the science doesn't yet back it up.
It was a very violent onset, so very scary.
Sammy Jo Wilkinson was just turning 30 when her body went through a dramatic change. The diagnosis, multiple sclerosis, an incurable, often disabling disease that attacks the central nervous system, and there's no known cause. Now, 15 years later, Sammy Jo sees herself similar to a stroke patient in recovery.
Because I've had this, uncontrolled microstroke going on all over my brain, iron deposits from the reflux of blood hitting the blockage and coming back into the brain, and lack of oxygen in the brain. So this has been going on in my head for 15 years, and leaving all kinds of scarring and damage.
What Sammy Jo describes is a radical new theory developed by this doctor, Paolo Zamboni of Italy. He's not a neurologist, but a vascular surgeon whose research began with his wife's diagnosis of MS. He calls it CCSVI, chronic cerebrospinal venous insufficiency.
The three major pathways are frequently blocked by narrowing in patients affected by multiple sclerosis.
He believes the blockage in these veins in the neck area causes a reverse flow of blood back into the brain, damaging the nervous system. He found the condition in 90% of Italian MS patients he studied. His solution? Opening the jugular veins with balloon angioplasty or stents, techniques originally developed for opening blocked arteries.
We found, for example, that patients with early disease, we have a full recovery of symptoms. Patients with severe disabilities certainly did not recover, but were with less fatigue, less tired, more positive.
And as word spread online about this possible cause of MS and a treatment for it, patients started pushing for the surgery now, including Sammy Jo.
It does have risks, but it was a risk I was willing to take, especially with the outcomes that I was hearing about from some patients.
Sammy Jo's web research led her to the one doctor believed to be performing the operation in the U.S., Dr. Michael Dake, professor of cardiothoracic surgery at Stanford. After confirming a severe narrowing of her jugular veins, Dr. Dake inserted 3 stents in October. But in December, he stopped performing the procedure. The university won't say why and prohibits him from speaking with us, but released this statement. As interest in the CCSVI procedure has grown, Dr. Dake and Stanford have determined that the initiation of a clinical development program leading to a possible clinical trial will be the next step. In fact, the National MS Society is coordinating a worldwide effort to conduct and evaluate research on CCSVI. Grant money will be awarded in June. Still, the Society's VP of Research characterizes the Zamboni hypothesis as a long shot and cautions patients to only have the procedure done in a clinical trial.
There's not enough evidence for me to recommend it to my patients.
Dr. Ari Green is Assistant Director of the Multiple Sclerosis Center at UCSF. He believes CCSVI is an intriguing theory, though very preliminary and in need of replication.
What we don't want to do is hurt people. In this instance, there have already been 2 cases of people who had stents placed who had serious consequences. One death, one person who needed surgery in which they had to open up the patient's chest in order to fish out a stent that had migrated away from the site to which it was placed.
There's things that could cause worry, but I'm a lot less worried than I was just about becoming disabled from MS.
Now, 2 months post-surgery, Sammy Jo says the muscle spasms that kept her awake at night are gone. Her husband noticed an immediate change in her appearance.
The thing that really struck my attention was that her complexion came back from a jaundiced look to more pink and healthier looking skin. That was almost immediate.
Critics point to the placebo effect, the power of the mind to affect dramatic change in the body, which is why randomized clinical trials of the CCSVI diagnosis and procedure are critical. Dr. Zamboni agrees.
We are on the way to solve a puzzle.
Just today, scientists at the University of Buffalo announced preliminary results of their research into the link between CCSVI and MS patients. Using Doppler ultrasound, they found more than 55% of patients with MS had a narrowing of the veins compared to just 22% of the healthy control subjects.